For flexion, it's just going to be the opposite movement. Your hands are in virtually the same position. That the only thing I would probably change is now we're going to traction up into the base of the occiput with the fingers that are down here. So, instead of being concentrated on your thenar eminences, you actually want to bring up your thumbs up on top of the head as well. So we're going to work in the big C here. So this time what we're going to do, we're going to take the pretension out, and that's effortless. From here we're going to traction up through here as we come off of the top. It's almost as if you're pushing or turning through your thumbs at the top of the head this way. On a neutral basis, I would say everybody start off doing this neutral. It's a little bit easier to feel the hand movements. So I'm just going to take that slack out. You'll find that most people don't have that much motion. Most of us go through life with that anterior head carriage, and the way that we compensate by keeping our eyes on the horizon is what do we do in the occiput to compensate for the anterior head carriage? We posteriorly rotate it. So a lot of time that upper cervical musculature is facilitated. They tend to be tight and not that giving. You're going to find a lot of people have problems in flexion. So what I'm going to do here is traction and push into my thumbs. If I do this correctly, the chin will kind of retract back into the neck a little bit. How far? Just till I feel the slack out. Once you feel the slack, we're just going to take the hands and we're just going to do the following. We're turning the ball. That's all we're doing. Feeling the give and the recoil. If you do it bilaterally, you'll have to think into both sides. On the exam, we'll ask you to isolate one versus the other. So I want to assess it as a flexion of the occiput on the right. Which way do I tilt the head? To the side that I want to assess. Kind of think of it, you're putting the condyle on a point. So I tilt the head to the right, I anteriorly rotate it, and then from there I just spring through that 1/8 of an inch. You're going to find that most people don't give all that much versus the left side. If you don't like these contacts, the other one, does anybody remember bitter beer face? Okay, thank you. We call it this way because that's what your patient will look like if you do this correctly. In this case, I'm going to take a general contact, and I'm basically just going to cup the base of the occiput. My hand pretty much stays on the table. It doesn't pick up off the table. The job of this hand is it just tractions from I to S. That's all it does. Now, sometimes if your hands are meatier enough, it might cause your patient's neck to go into flexion. You may have to compensate by dropping the table down a little bit so they drop back into neutral. From here, some people like to come this way, but I'll tell you, if you're the patient, you're watching the fingers because you don't know where they're going to go. Maybe you hope they don't do this. So I would recommend is just for the most part, cup your hand this way. So if I want to assess, again, flexion of the right occiput on the right, which way do I tilt the head?
To the right.
To the right. From here, this hand tractions from I to S. As this hand distracts from S to I, we're just turning this ball. That's all we're doing. Now, if you do this correctly, the chin, once again, kind of retracts back into the neck or into the table. And then vice versa. If you do this correctly, the face comes to a good view of face. Which, if you haven't seen the commercials, you have to go to YouTube.
What are lines of drive for both moves?
Well, for flexion, we've got to look at this the opposite way. Say this time we want to cause, with flexion, we want to cause anterior rotation of the head. So in essence, our line of drive relative to our segmental contact point. And have you tell me, relative to this next trimester, we're causing this motion. So it's going to be inferior to superior and anterior to posterior. If you can remember one, just remember that flexion is the opposite of extension. So instead of S to I and P to A, it's A to P and I to S. Relative to the segmental contact point, or your thrust point.
And on the second move, you don't have to do two lines of drive. This one's going S to I, this one's going I to S.
The question is that for right now, would be concerned of what your contact or your thrust hand will be. Now, Dr. Hall next trimester will also want to add is what is your indifferent hand doing at the time. Right? But we'll leave that. We'll keep it in steps because he's going to